Hi, I'm Dr. David Maloney from the Fred Hutchinson, Seattle, Washington. And it was my pleasure to chair the immunotherapy of CLL session with Professor John Gribben. I think the really highlights of this session were first a very lively debate on the role of CAR T cells in CLL versus the potential curative role of allogeneic stem cell transplant. And Jordan Gauthier and Professor Peter Draeger presented the pros and cons of each of these approaches in just an excellent debate. And I think the highlights from this are that both procedures are promising, but quite complex. We know that allotransplants are often said to be the only curative approach for patients with chronic lymphocytic leukemia, but it clearly has a high non-relapse mortality and risk of GVHD and through predominantly the risk of GVHD and infections. These really needs to be under good control for the best outcomes. And so more recently, this has been shied away from due to the emergence of newer agents and actually to the experimental use of CAR T cells. Now, CAR T cells have been approached using mostly CD19 directed autologous CAR T cells. And in the CAR T cell setting, the patients are almost always refractory to all therapies, often including BTKI and BCL2 refractory disease, and they may have bulky and advanced disease, which wouldn't actually make them appropriate candidates for allotransplant. And what we were seeing is promising remission rates, including MRD negative remissions in relatively early follow-up. The toxicities may be severe, but they're generally transient, and this just generally translates into a lower risk of non-relapse mortality, but we clearly need longer follow-up. So what we were seeing in the world basically is a decline in the use of allogeneic stem cell transplant as these more novel treatments become available. And it seemed likely after this debate that most people conceded that CAR T cells, if they become approved, will be more often used prior to considering allogeneic stem cell transplant. And this was really an excellent debate by both Drs. Draeger and Gauthier, who gave excellent points. So we also had excellent presentations by Adrian Wissner on T cells and how bispecific antibodies can activate these T cells, and by Jan Berger on the role of T cells in CLL. Are they helping or hurting? Both of these talks demonstrated that T cells are important and that they can be modified by agents such as lenalidomide and BTKI exposure. And these observations may lead to future combinations or potentially even targeting, for example, cells like T follicular helper cells that may be helping the CLL proliferate. And lastly, we had two abstract presentations. William Weirda from MD Anderson presented results from the CD19 CAR T cell trial with lisocabtagene maraleucel. In the phase 1 trial, it was done in combination with Ibrutinib for relapsed and refractory CLL. And this again showed very high response rates and molecular remission rates with a reasonable toxicity. And we just need to follow patients, I think, longer to see how this goes. And this is one of the more late-stage trials in chronic lymphocytic leukemia with this agent. And our last talk was by Lenka Dasilova, who showed interesting data that CAR T cells could downregulate or so the CLL cells exposed to CAR T cells could downregulate their CD19 expression by a process of promoter hypermethylation. And so this leads to, potentially some observations about how we could we could combat this or potentially increase CD19 persistence on the CLL cells. So overall, I think this was really a great session at iwCLL with very interesting data and a good, lively discussion.